All right, so I'm really, it's January 24th, it's hard to believe, 2022. That might be a good topic, is talking about how we age and time and years during the span of COVID. Gloria and I were chatting about that for a couple of minutes. And I just want to first introduce the guests today that I'm very much was looking forward to, and I still am. Gloria Riccardi Castillo. And did I say Riccardi right? Because I never used to say your other name, you know. I used to always
said it right. You said it right.
And Gyasi Burks-Abbott. And just for those of you that may not remember, because Gloria's been on before, she's the family sports director at Northeast Arc. And, you know, I just threw a couple of your achievements, and I was thinking about the stuff you did around autism and autism support and the iPads and the fundraising to get iPads out to transition age and other folks. And also the work you've done, families from diverse communities. And I know you've helped us at the state level with the advisory board to think through before COVID, you know, we haven't had a meeting since COVID, but to think through what we should be thinking about at the ARC. And then Gyasi is staff to the LEND program at UMass Boston and Children's Hospital. He's also been on before. He's an activist and board member of several organizations, and he's a leader in our community. And I know for a long time was on the board of AFM and active in government affairs there and active with us, and just really appreciate both of them so much. So before we talk and kick around the key issues today, I wanted to give you an update on the COVID and what's going on. And hopefully we're at the end of the peak. It seems to be that way in our community. I want to thank EOHHS and Public Health for updating the economy of care numbers before 1 month. We had communicated, some of you might remember, we had communicated with them and asked if we could get more frequent updates given the peak that has happened. We don't have numbers in terms of weekly, death numbers, though I know my colleague Rick Glassman said he was surprised at some numbers at DMH that happened in terms of deaths in folks served through DMH. In our case, in that short span between the last report, which was dated about December 29th and January 11th, there was no deaths in that time period, which is great news. The infection seemed to be milder, but our number was at 735. And the last time, 2 weeks ago when we talked, the number was 156. And before that, the number was like 40. So just to give you an idea of how much it ballooned during the peak. And this is, in a community that already had a fair number of viruses, right? We had about 22% across the board, both state operated and private, somewhere between 22 and 24%. So we're at 68 positive cases at the state operated sites, 735 at the private operated sites. So the percentages are nearly 10% and 7%, those two communities. About 10% of state staff have COVID infection, which we don't get the numbers on community organizations because I assume it'd be too complicated to collect. I'm not surprised about that number because I can tell you anecdotally, a colleague of mine at a community agency had 3 times the staff infected and he had to get relief in, right, and other staff than the people with disabilities that he served. And then from a cumulative standpoint, state operated has had about a 35% positive spread, while privately run are at 32%, but catching up, because this round, the reported numbers are higher on the private end. As reported previously, Rentham and Hogan facilities had higher infection percentages, throughout the crisis, 46% and 58% respectively, which is very high. And right now, only I think the numbers, according to the report, are 97 and 21 in terms of staff infection. So hopefully, what we're going to see, hopefully we'll get a report in another 2 weeks at the most. And again, hopefully this week, I'm hoping, since we did get one on January 11th. And really, again, appreciate the transparency, additional transparency. And just want to show you, shared this once before, what happened in 2021 in terms of impact on services because of COVID and the workforce crisis. So just to give you a feeling nationally, some number of states reporting, 25 states reported some closings of home and community-based service providers, 19, adult day health providers, in-home service providers closed, 12 of them, It's across the country, not Massachusetts. Supported employment closures of 11 across the states, 11 states reported. And this could be just a few in each state. We're not saying it's wholesale. We know in some states it's worse, like Florida, than others. And 8 states reported group home closures. And there's the behavioral health one is the last one. So the workforce crisis is still with us. Okay, as COVID peaks and ends, we still have that, and we still need to advocate together in Massachusetts and the nation on that. So I also want you to know that we just released a report, but we can't put it up today because the big secret that Katerine Daly posted this weekend is that our new website's going up today. So we're not posting anything today. So, but you will see a dated January 24th, an update on, you may recall DDS sent out a memo about financial help to the organizations in the field. That memo is sort of summarized by us for all stakeholders. So, and we also, it links to a 2-page memo if you really are up for it, that tries to explain things a little more concretely. And we also show you a diagram of what's happened to day services by using one example, a make-believe example that serves 50 people in the community and what happened through this crisis and what what happens financially, what happens in terms of number of people served. Okay, so it's just one sample to give you a sense of what the impact is. So that was released today. It'll be online tomorrow. But if you want the longer document and see the day program thing, if you go to our policy page by going to the archimedes.org advocacy, the advocacy banner there, and you get there, you'll see a policy issues and look for 2022, and you could see it today. So even though we're in process, because she put it up over the weekend. So access and diversity. So Gloria and Gyasi, again, welcome. Thank you for being with me. This is just questions to get the ball rolling, right, for us to talk about, because it's this big a question, right? It's not like this, and it's different. It's not like one answer solves, that's the whole point of diversity. And access, of course, there's different barriers in different places. So, we can start generally, or we can talk about what COVID's done in terms of it. And I'm gonna leave it to each of you, because I know you've thought about this a little bit. Should we talk generally at first, or would you like to talk about the impact of COVID and what additional barriers that might have done in terms of inequity? What do you think, Gloria? Do you want to start, and Gyasi?
Sure. I think in general will be better. But we can start with COVID. So we have seen through the Family Support Center and the Autism Support Center, there are the centers that I oversee, those families, of course, that not only diverse background, but with needs of means have big impact. COVID has had a big impact on their livelihood, and so that has been difficult. So we were actively working throughout the pandemic with our already assigned DDS funding, and also restricted funding allocated for families in need to provide support to those folks. And it's been a big relief for us as an organization to be able to tap into those resources and help families in a moment notice, without going through all the red tape that is needed. We've seen with the older parents, especially in the North Shore, that's the Family Resource Center covers, a lot of issues with, some of their loved ones with mental health issues. That was very difficult. And we have some wonderful people in our staff that were able to provide some, with credentials, to provide some, quick supports, and that, with guidance and support in that department. But definitely it's been, it's been tough for all of us, but for the families we serve, it's been absolutely way more difficult. And thank God that we were able to help,
On the mental health side of it, and then Josh, I want to ask you to weigh in after that. I do worry that we tried to talk about trauma guided care and whatever. We had 3 or 4 sessions on that. And I'm sure organizations were doing that internally, but Trauma-informed care, that's the right word. Okay. Um, I don't think we have a handle on that, right? You have a handle as you have an emergency, right? And somebody reaches out to you. They have to know to reach out to you or someone else, right? In the first place. And then sometimes they end up in a hospital with general care. And, so you have staff on hand to help with some of those situations. But then if you were going to look for somewhere up in the North Shore, if people get referred, I can't imagine that must have been really difficult getting access. Right?
I guess what I would, in terms of going back to your question about, is it COVID or is it separate from COVID? What I've been finding in the last couple of years is that COVID has not only made things worse for certain people, but it's also highlighted problems that already existed. I mean, like a big problem, for instance, is the digital divide, which I actually did research on when I was in library school 20 years ago. And if you think about, I mean, a lot of people like us on this call benefit from being able to, for instance, be on this call and speak remotely to each other. And so basically go about our business to a certain extent because we can work from home. We can do things remotely. But there are people who can't do that. They don't have access to broadband, or they can't work from home because they have to be. They're an essential worker. So in essence, the pandemic has made things worse, but it's also highlighted problems that already existed.
So people that might be economically disadvantaged, regardless of right background, and they're going to be further disadvantaged, you're saying, during the crisis. And how about people with disabilities that may need someone to help them access it?
That's true.
Right.
I mean, actually, a case in which actually the pandemic not only highlighted a problem, but kind of made it worse, was at the beginning, they were going to do the stimulus payments. And immediately when the stimulus payments came up, there was a problem of isn't that going to affect people's benefits? Because it'll make people having too much assets. So they solved that problem by sort of putting it off for a year. But the assets limit was already too low. It's been too low for decades. So it was a problem that already existed, which only became highlighted when yeah, I mean,
so many people were benefiting, right? That they realized they had to do something. In fact, that's something I was on the phone with Bethany Lilly from our national office. We do have a substantial gainful activity group that's been meeting. COVID got in our way. But to your point, Gyasi, that's something that I'm hoping we'll tackle, because again, talking about economics of this, and you were pointing that out, Gloria, and some of the families you're working with, that their livelihoods were threatened. One of my colleagues would say to me, Leo, I have people that when the minimum wage goes up, they're going to cut their hours back because the family doesn't know what that means for that person's Social Security. And some of them are helping, their household is being supported by some of that Social Security. So the fear of that, and so thinking again, and Paula just mentioned, even registration for vaccines and testing is all online. So if you're not computer literate, it's impossible now. And but it's impossible, but there is a hotline to call, right? They responded after those early months to do that. What kinds of things and take it anywhere you want, Gloria, in terms of families and individuals, but in terms of the hardships of people losing jobs and things like that, what did you guys witness, and what do you worry about for the future?
So many different things. So, for example, families that, they couldn't afford because someone lost their job and they couldn't afford to pay for their electric bill. Now it was too high, or they couldn't afford to buy food, or they couldn't afford to pay for the co-payments. Those of them, they have providers coming into their home. So it's an array of different things that people were needing. And, just keep in mind that from one of my centers, the Family Resource Centers worked closely with DDS, and having, that very good connection that we have with them. And if we needed maybe a little more funding, or we needed anything, they were right there helping us. For the Autism Support Center, it's a little different. We have not a small, but percentage of families through the autism waiver that, they have a nice budget to work with, but those families have other needs that the waiver doesn't cover. So that's where, someone who couldn't pay their rent, we help with that. Someone who had a car, they broke down. We were able to help with that with our restricted funding, and many other, situations. And
Wow.
so the good thing is that when I find out with the diverse group that we serve, and this is something that has been really, for me, a little bit of an eye-opening, the difference of the people that have their own communities and they're close. So, for example, the support groups, we have a few support groups that are diverse. Those people meet the same group most of the time, and they have developed friendship. Although, as you know, most of our groups now have been in Zoom, via Zoom. So, but they support each other. I had people call me because some other mother was going through something, but she was embarrassed to approach. And so they help each other. So that's the good thing about those small little groups, that they really support each other and help each other, but all kinds of needs throughout the pandemic. And we're lucky here, the Northeast, I said lucky, blessed. We have those other funding sources that we can just help families in need in any given time.
So we've been really worried about that. And actually the things you just brought up, a car breaking down, whatever, one of my colleagues just wrote me an email over the weekend and said, something we don't have on our messaging list for our 2023 budget, by the way, we're working on both by ourselves and with the Trade Association, ADDP, to figure out where what are the common line items. Obviously, we don't want to disagree with each other on certain line items. But she said to me, I'm in a text group and there's some serious issues. For example, my son has broken his iPad, and so there's other ones too. They're out of frustration, the isolation. There's people that need a new bed because the bed broke. Gloria, the stuff you just pinpointed is something very real. And I know there's limitations in goods and services. And we're hoping actually that's an issue, because I would think services are reimbursable. So I don't understand that one, but if you have money in your budget, but the goods piece, I guess there's limits, right, on the availability. So that's what we worry about. You've been fortunate that you get other revenue to make up for that, but there's a lot of across the state people that aren't able to get that other revenue, right?
The guidelines are the guidelines. So we have to go by those guidelines when it comes to, so that's what like you were saying, and having the other funding source is important, because that is not every day that you get someone asking to repair their vehicle. But sometimes people, that's the only vehicle they have to go to work, to take the kids to school or therapy or whatever. So we looked at everything case by case. And I always mention, and I give thanks to the Flutie Foundation and a couple of other foundations that support us. And now in our Parent Advisory Board, we have a committee, it's called the Rock the Spectrum Committee. They have fundraised dollars for the family served by the Autism Support Center. So that makes a huge, and we always have a little bit of extra funding that we were able to help people, which give us, such a satisfaction that when you get a call from someone who's desperate for it in any given situation, and we can say, yes, we can do that. That's huge. And I know not every other parent support center, not parent support center or center has that luxury, I want to say, but it's good that we do have it.
I want to talk about Turning 22 a little bit and get Gyasi to talk about adults, looking for services, but I want to come back to how you got those smaller groups going, because I do think that's a missing ingredient statewide. Some organizations are able to do it. Some organizations have them. And I know there's specifically ones, I don't know how often they meet together as families for complex medical conditions. I don't know to what extent. I know friendships grow out of those groups as well. But I think that's something during COVID and beyond that we're going to need, because you gave just a great example of how someone called on behalf of somebody who was embarrassed. But we can think of other reasons, right, that people won't reach out themselves. They have 2 jobs. They're overwhelmed. Language barrier. So, we have, I got to tell a story about language barrier, which I never knew till later. And it's a historical story that ties into our modern situation. But one of our, famous activists was Dan Becker and his wife, Angela, and his son, Michael, who predeceased him. What I didn't know till literally a few years from Angela's passing is that the family was Italian immigrants. And Angela had played the role of translating for her family throughout those early years, both. And there was a number of kids. It wasn't like, I think there was 5 kids in the family, if I remember right. But that happens today, right? And as well. And that's a barrier I'd love to talk about and get to in terms of how that's facilitated. I want to ask Gyasi about turning 22. Everyone's experiencing a turning 22 stoppage. Gyasi, what do you think from the people you talk to and the experiences at Lend and elsewhere? What you want to add about that and adults who are looking for, their own self-direction, their goals, and their journey.
Well, I guess I know a lot of. I guess there's supposed to be exceptions to turning 22. I don't know how that's really going in the State House. No, there's people
at school. You mean at school, being able to stay at school?
Yeah,
right.
So supposed to be that.
There's no formal bill, so they're required, right? If people ask, if they get it in their IEP, and of course people worry about it, should be just mandated, right? Instead of just supporting it, because what if people don't ask, right? And then they're not going to get it. But go ahead, that's a great point.
What I was going to say is that in terms of, I guess, even if not turning 22 specifically, but just sort of growing into adulthood, and having that transition, it seems to me that COVID has been interesting because I guess a lot of people, I've heard people say that they've discovered skills they didn't realize their kid had. In other words, because the context has changed and they've had to do other things. So they've actually started other things. Like I know, like one parent I know, for instance, to start cooking with her kid, or people start doing different things. But other people have not been able to adapt as well because, for instance, going to school over the screen just doesn't work for them. Right. So it's, but
no, good.
I mean, I guess for me, it's like I always like when people talk about. I guess I want to be an optimist. It's like even when people talk about, school, it's so important to do things in the traditional way, go to school and, go to a place. It's like, I like to think, well, there are other ways of learning and that maybe, we can somehow learn from this experience and actually take something good out of it.
Right.
Because, and then I think, even if the kids haven't been going to school, they've still been learning something. They may have been learning resilience, for instance, or right. I mean, I don't know.
Well, the workforce crisis made it worse, right? Because if you could have somebody go to someone like Paula just said, she's turning 22, it's been a disaster because her son is at home doing nothing. And Kristen writes, I work in the juvenile court, and we're seeing a lot of adolescents with ASD coming into the court with delinquency charges or through a CRA, which I used to know what that means. You're gonna have to help remind me what that means, Kristen, the CRA.
So
Can you type it in? Child requiring assistance, got it. Okay, yep. We used to call it, so by the way, there used to be 4 letters. There used to be another term.
Chins. It was the chins, yep.
Let's see how old I am. Okay, so I am a clinical social worker, so I knew it well, but and they're told not to bother to apply for DDS until they're adults. Well, actually, they can be. Actually, the autism program, I'm not sure, but actually there is a children's program for a broader children's program for people with developmental disabilities. But they're not. The point there probably is they're not going to get prioritized probably for an intensive service, and that's the dilemma. So we have to find a way to connect the kids, and I'm not sure how much too the diverse community impacts that as well. And so that's something to think about, to what extent. By the way, Stacy just posted for ASD Adult Services in the Northeast, 18 and older. There is S. Wilsey and Northeast ARC. You can see it, Dash. You got to look at it, and she and her group can help with DDS applications. So that's great. It's any-arc.org. So thank you for that. And then we can, there is on the website DDS, there are family support centers listed. So I think people, that's a route, by the way, to use. So even to go ahead and do it anyway. So to start building something around the kids.
Yeah, because Sarah's group is adults with ASD, no ID, but she can certainly help with applications and can connect with Gloria's autism support too for help,
Right.
depending on where they are. But she definitely can be a starting point to kind of get them started. So if it's the Northeast, she has specialists like throughout different regions
Great.
can help. So.
That would be great. Thank you. So I'm going to bring it back to, for a few minutes, I don't know if I should pick the language barrier or what barrier, but in terms of diverse communities, Gloria and Gyasi, if I was to say what our report card is, we have these multicultural centers, right? That's great. And they've been around for, I want to say, 25 years, okay, 1990s,
Yes.
right? Am I right about that? Probably? Because I
Yeah,
remember
more or less. Yeah.
Yeah, someone called me, by the way, to complain about the multicultural center, someone who was very active in DDS and the ARC. And I said, well, what are you asking me to do? What are you actually, like, you don't think people need help who come from different backgrounds, whether they're new to this country or not, that, that don't have access right now. They don't even know how to walk into the system. And she backed off right away. And it was actually reflected well on her. And it was a region that always felt deprived of DDS services when DMH and DDS were one agency. So I think it was coming from that place of not enough. And why are we giving to others when, real Americans don't have enough? That was how I read it, and just trying to help her see all of us are real Americans, And so it's interesting. But I do think we're better than we were, but I think we're still far from the goal. And what would make the goal? How could we get to the goal? I know you're a big one for encouraging people to learn English as a second language, because so much of things are in English. But how could we be better at this in terms of access? And of course, to put in perspective, everyone's got to fight for access, right? It seems like if you don't advocate, you don't get the right program. And that's why I think people from a different background are even at a higher threshold to fight, because they're starting from maybe less ability to speak the language, less ability to understand the system, right? What could get us there? That's a big question. What could we do more?
Is it this question for Gyasi or for
Both
myself?
both of you to jump in.
I guess you have me thinking along several lines. Like, I wanted to mention about mental health, because actually an article just came out today in GBH about one of the things that's happening in terms of mental health is people are winding up being bored in emergency rooms because there aren't enough beds. And actually, I guess there was a bill that passed the Senate, the mental health
Parity bill. Yep.
Mental Health Bill 2.0, which was supposed to address that. It passed in November. So, I mean, that would be an improvement, because it would actually allow people to get mental health care, maybe even from their houses. Now, going back to what you're saying about...
By the way, Gyasi, there's also at least 300 million, maybe more, in behavioral health that the legislature approved for behavioral health improvements. Just put that out there too. Go ahead.
But I wanted to address what you're saying about different groups having access issues. And I think you sort of covered that when you suggested that they're already starting at a disadvantage because, for instance, they don't necessarily have the money or the cultural capital, or they don't necessarily have the connections. And they also may not feel empowered. They may not feel like, I have a right to, that's where advocacy comes in. Learning that you actually have a right to ask for these things and that these things are yours for the asking.
Yeah,
but you also brought up something else that was interesting when you mentioned about the idea of real Americans, because Heather McGee, who used to be president of Demos, she has a book called The Sum of Us, How Racism Hurts All of Us and How we all can prosper. And she talks about the zero-sum hierarchy. In other words, the idea that if other groups get, I lose, versus a solidarity dividend where you work across racial lines and do together what you can never accomplish on your own. And in essence, part of the reason why, at least what Heather would say, is services are so meager in the United States is because in the last few decades, government has been disinvested in, because the idea is that people undeserving are getting our tax dollars. And this actually hurts all of us. Right. Because we don't have the services we need. And so in essence,
so we're starting, so your point is we're starting here And then, of course, it's going to be harder for people who don't have the same tools as someone else to access, because there's not enough in the first place. It's not like we're holding something back that's there, but so we could do better maybe at connecting with groups around empowerment, with different groups. And for a long time, we had relations with 2 or 3 groups, but not probably enough, but we're also not super big. So we have to figure out how to do that with groups that are out there. Maybe that's something.
We also have to change the thinking. Like if you think about one of the things that's holding the Build Back Better bill up is you have people saying, well, Build Back Better, like you have one senator saying that the child tax credit will be used for drugs, or
Right.
that the family leave will be used to go deer hunting. It's like we need to change that attitude. That this is actually not. This is not. These the thinking that government only helps the lazy and the ne'er-do-well.
Right. So there's the politics of it, right? And as long as the politics are either false stories or just about who wins and loses. I heard Callie, can't remember Callie's last name. She's been on GBH and radio for a long time, but she talked about how poorly the media is covering the political issues, that it's about win and lose.
Yeah.
And Crossley, thank you, Susan. Also, Susan mentions a chat earlier, maybe a different Susan, that people of color are underrepresented and less welcome overall. Well, I just want to encourage people to join our GA.
That was
committee.
me.
Okay, I just really want to encourage. We have a GA committee that meets monthly. We're going to just have to post it all over the place so people, and it's meeting by Zoom, and people can get. It's not just advocacy oriented, but people learn things by attending the meetings about bills and what's going. In fact, Gyasi mentioned the mental health parity bill a few weeks ago. We decided to stick our nose in it, and we should have stuck our nose in it probably a year ago. But because it's still in play, it's still being deliberated in the House. We're hoping to have some language about the boarding issue and people with disabilities that's not there. So we reached out to the groups that have been advocating for the bill to make sure they're not upset at us for, whatever we do doesn't, get in the way of what they're trying to accomplish. But in fact, ironically, the bill mentions state agencies and includes like DCF right in there and others. It does not mention DDS, which I think is interesting given the boarding issue we have in hospitals, both regular hospitals and psychiatric hospitals. So, and then Daphne said, there's so much of a don't ask, don't tell stance to barrier if you don't know what to ask for. Yeah, that's helpful, Daphne. Like, so if you go somewhere where there's a gatekeeper, you're saying that people don't automatically tell you what's there, what their options are, even if they have to wait. Is that what you mean? And of course, the people don't know what to ask for.
Yes.
Right? Yeah.
Yes. Or they don't know a key word, so they'll ask in a way, but if it's not said in a certain way, it can be denied. And so it's very frustrating for parents. And a lot of work I do is to try to help people plan and be prepared and know how to go in and say, okay, here's what we need. How can you help us with this? And be very specific. But even when you are specific, sometimes there's just a lot of nobody wants to take ownership on answering your question.
I hear you. Yeah. And if you're specific, you would think then people can use their jargon to connect it, right, to what the specific needs are that someone's sharing. But you're also talking about the eligibility and prioritization process, right? You're saying there's some magical words that people might not have.
Yeah, I mean, like sometimes it can be even jargon, for example, different phrases that, let's say, DDS uses for services. Well, if you are new to this country or new to the state or whatever, you don't know that language. You don't know that. So you're saying it in everyday language, right? You're trying to express in a way, but oftentimes there's just this disconnect or this wall of, we're not gonna say this. You have to specifically ask for it.
I hear you. And Paula said 100%, Daphne. So, that's a big term. When did 100% start? Okay, I'm not going to get distracted. I'm sorry. But people say that a lot these days. So Gloria, how do the small groups get started? Okay, that you do have. That's because I feel like Brockton did some of that too. But how do you keep it going? Is it staff? Do staff make sure they keep meeting? Because, that would be great to get going across the whole state.
Well, I think the groups, because the groups that we have, they are separate from the traditional group for, parents, for kids, school age, this and that. These groups started because, number one, it was the language. I thought it was only the language. So we started with 20 some years ago with the first ever Spanish speaking group, since that's my first language, in Lynn, Massachusetts. And then when I moved to the Autism Support Center, we went to Lawrence, and I worked with doctors and school personnel. What is the need in the community? And some wonderful people that I'm seeing there, like Anlene Lee, connected with professionals. And so we find out, and we started a support group there. So for me, for that group was the language. They did not, families mostly from the Dominican Republic did not speak English. So we started a group, but bringing information, not just a group to sit around and talk about, the kids with autism and therapies, and that was important. But we brought Massachusetts Advocates for Children to talk about, what is the obligation of the school for children with autism. So that perked up families' ears. And then one of those parents, after a couple of years, wanted to do the federation training. And that parent has been an advocate for families, Spanish-speaking families, for years. That's one story, and that was a language thing. With other groups, like the Arabic-speaking group, the Arab group, they all speak English in that group that I started a few years back. But the sense of community, the people wanted to be with their community. And that was that has been a wonderful group. It's been in Zoom. And although those families, you can say they can join the English-speaking groups, they want their groups. They want
It's like a cultural piece to it, right?
It's a cultural piece, and it's important for them. And so men are not, are not invited to this group, because then the Arab group feel comfortable removing their scarves and being comfortable among the group. So that's another example. So this is not a diverse group, but it is for us, because we've been running with 31 years old, the Autism Support Center, and we've been running groups for many, many years. And fathers, we will have one father showed up to a group. So then we decided we're going to do recently we started, there was a group for fathers years ago, and recently we have a collaboration with a fathers group, and it's going fantastic. For years also, we have an Asian support group in the Lowell area. All these ladies speak English. Same situation with the Arab group. And they stay connected, they support each other. We have offered retreats for them in Maine that they go for a weekend. Fabulous opportunities for them. We also, we will have a speaker, or we will have opportunities for have fun and for the mothers to relax.
So how much time? So 2 questions. So someone gets it started, I assume, 1 or 2 people get it started. So, and then how much staff time does something like that take to keep going?
Well, it all depends, because if you created the group monthly, to keep going with the group, keep advertising the group, but most of those families come through word of mouth for the same participants that are there. They have seen the benefits of being together, in learning about their, how they can help their children or their situation, education about laws, everything they have to do with their family member. But I think I'm going to jump to another thing before I forget. For me, I'm more concerned about all those families that don't know anything about us, and all of you here in this meeting today, because families don't know what they don't know. So outreach is super important, and I always moving around. I have a different role now, but I still going out and see where we are needed, where we can do something, where there's a large community, that a diverse community needs a little help. And recently I connected with the Cambodian Association in Lowell, and we are working together in a nice collaboration for a support group for those parents. Again, most of those parents speak English, But if the need be, we can afford to pay for interpreters for that. So family, that's how you keep the group. And also just remember that I was in a meeting with our parent advisory board this morning. We can't turn it off. That's why we train our staff. We need people to be motivated and excited about helping families. So staff time is whatever it takes, I would get. That would be my answer.
Okay.
To get the group,
Actually, Lucy Chansky has had her hand up. I think she wants to say something.
But it's a different topic. It's on, I communicated privately.
Oh,
with
sorry.
her. It's about guardianship. And Lucy, I can talk to you offline. Happy to do that. And maybe we'll have a few minutes at the end.
All right, it's about the delay because of COVID.
Right. No, but our topic today is diversity and access. So I didn't want to, we have a few minutes at the very end.
Okay, and I don't know if other people are having trouble using the chat, but mine, I can't use it. It's expanding every letter I type, it puts 20 other letters in.
No, I saw your message and I did write back, so but not toward the end because it's so busy on the topic.
Sure.
So in Gyasi, I'm sorry, I lost that. See, that's exactly what I'm trying to avoid. I just lost your point. You said something just now.
Lucy Chansky had her hand up. That was.
Oh, okay. All right. See what I mean? I couldn't even remember that. That said something about me. Okay. Apologize, folks. So the whole point is once you get started, you can't stop because it's like momentum.
And you keep the connection with the families. You have to have the time, and the centers are very busy centers, but I usually the one who coordinate with the diverse groups, because even if I have to talk to them over the weekend or someone needs something, it never stops. For many of us here, it's just the way it is. But I think that keeping that interest in the families, what are the needs? I don't know, I'm always communicating with the families. Is anything that, something, we're doing something different, you guys interested? I'm always keeping them. It's hard at the beginning. It takes time for people to get comfortable, to trust you, and to feel like you're looking out for them. Because just remember, for many diverse group, and some of you who have worked in this field, and I see my friend and former colleague, Judy Doherty, there. Hi, Judy. You know that it takes time for people from diverse community to understand that what we do, a lot of stuff, we do it is free of charge. And that is kind of, people don't trust that sometimes. What do you want from me? I don't know if anybody has anything to add to that, please join in, because at the beginning it's like, okay, so what do you want from me? You're so invested in helping me and my child.
Yeah, there must be something up your sleeve. Yeah.
That's right. And then they realize when they understand, because we have to understand that they come from different worlds, some of them, not all of them. I'm from Chile, and I didn't come from a different world, but some people from other cultures don't trust the government, the system, and it's tough. But as you keep doing your job and showing them that, you have their best interests at heart, they trust you, and they're happy that they're joined, with us. They're with us. They're part of our village, that we like to call it. We have a big village.
Yeah. Sometimes I wonder if there's another barrier that comes from the other side, the side of the provider. In other words, if we tend to think of disability or even autism as something that really only affects certain types of people, usually white males, middle class, whatever, or upper middle class, people might be missed who could actually benefit from the services, and they may not be referred when they should be referred. In essence, if the person from a marginalized community doesn't know to ask, and a person from a person in a position of authority doesn't know to say anything, well, the two are never going to meet. Yep. So,
Great point. And also, I just want to note, Ronnie mentioned how these social supports don't exist in some countries, so that might be why people get thrown off. And then Judy said, I think that helps if you're able to let them know you connect as a family member yourself. Daphne agreed with that. It's a great point. Because regardless how different you might be, there's some things in common, right? At that point.
People feel a connection. I do not volunteer personally, but if someone asks me, do you have a child with special needs? I do say, oh yes. And then they said, so how is he doing? And they start asking more questions. I said, he's fine. And I bring it back to their story, their problem, their situation. It's about them. It's not about me. So I think that I have a genuine interest, like many of my colleagues here do, in help families. That's what we talked about. We're here to help. We have the opportunity to do this, and we do all these trainings on Zoom now. We do all these connections. We want to keep that connection alive and keep teaching family. We want them to be in the know. I always say that. You have to be in the know.
Right. I'm going to, what I think we can do is ask that, every year the Family Sports Centers get together for a number of times, but in a big conference too. So maybe there could be, I don't want to put extra stress, but we could talk to Ellen Carson about maybe get a sense of, where different organizations are connecting across the state with different groups, and see if we could take stock of that and strategy. And then Linda mentioned schools need to know we exist. Counselors should give out information on DDS and family support centers. That's one way to get the word out, Another way, of course, though, some people won't reach out after that, Linda, but it is a good way at least to start. And doctors, and in the old days, we used to get information to, medical groups and stuff. And I think the world got complicated, right? And suddenly that was harder
we
to
still do.
You're
Leo.
still doing it.
We still do send out our brochures and, to, doctor's office. We do the best we can to connect, and we have every professional that call the centers. We have a database, and then we send them our newsletter every month. We have 2 newsletters from the Family Support Center, the Autism Support Center, and now the Adult Autism Support Center, newsletters with information, keeping that, and people
That's
that
great.
don't want our newsletter can unsubscribe, but it
Right.
works. People learn through them a lot.
Right. And then Judy mentioned she's on the statewide implementation committee, and they're working on addressing, who's connecting to who. So that's great. That's great to hear, Judy. Judith, I should say, but I called you Judy all the time. So
Judy forever.
I'd never seen it in writing until later, right? So it's like,
I call myself mommy, share anything.
That's good. That's good. I know it's another person I haven't seen in a long time, and the same with Linda too, and others here. So, and then sped packs. Well, sped packs are struggling. They need support and strengthening. And we were just talking about other developmental disabilities a week ago with 2 new leaders that are working on FAS advocacy, fetal alcohol syndrome, and they were, one of them was really disappointed, sped back. And we talked about how if you group with other families and don't worry about your own diagnosis so much, and especially, work as a group to get the right IEP services, that's always a better strategy. And it's a higher level activity, but it does make a difference versus you going in on your own and trying to advocate for your own good plan, right? So I'm going to thank Gloria and Gyasi for their time today. I really appreciate it. This was exciting. Everyone that contributed today, thank you. And Lucy, why don't you let me know what court you want to connect to, and we can see if we can help you make that. Kathleen Amaral, maybe we could help her make that connection. And I'm sure there are delays, and everything. There's been delays. But if feel free to, you can, my email, but feel free to, and I'll see what Kathleen can do to help process that. But I want to just thank you, Gloria. Thank you, Gyasi. Thank you, others too.
Thank you for the invite. Thank you so
Thanks
much.
for the invite.
Pleasure to have you. And I just want to also, in
Hi,
honor of
Eileen. Bye.
Martin Luther King, I just want to just say we didn't talk much about him today. I know last year we did, and we skipped 17th this year and took the day off. But just what a treasure he was and still is, his thoughts and contributions. And we have a long way to go. But the path to justice, he talked about it being a long arc, and we just need to continue together in that direction. Thank you, everybody. Have a great week.
Thanks. You too.
Thank
Have a
you,
great
Leo.
week.
Next week, we're going to talk about
Thanks.
self-determination with the DDS folks. Take care.
Excellent.
Bye-bye.
Bye. Take care.